yabo konke mase kusemahlomba akho kuba nzima kuba buhlungu not to say ukuthi bengifuna ukuthatha impilo yami ngoba ngibalekela umntwana icondition yomntwana not at all ukuthi kuza konke emahlombe ami kuface mina angikhona kusebenza angikhona kwenzani ngibanje umntwana yabo leyo nto leyo iyashaya futhi ukuhlala nomntwana okhubazekile kungenamuntu okuncedayo akunamuntu okuncedayo ngemali akunamuntu okuncedayo ngokuthi amthathe maybe mhlambe kuvaliwe izikolo khona uzomthatha na uphumule next uzosebenza every day every week every month every year akuna holiday akuna ini akuna sangidepressa zonke lezo zinto lezo yize zifika ngamandla kimi ke wabona ngibona ukuthi yazini ngibuye ngithini mangihamba uzobheka ubani lomntwana.
According to the World Health Organization, half of all the mental health illnesses begin at age 14, with most cases going undetected and untreated. Among adolescents, depression is the third leading mental health illness. In addition, suicide is the second leading cause of death among 15 to 29-year-olds. Now, while the global needs for mental health care are gradually becoming more visible, such needs remain inadequately addressed, especially in Africa, and then especially amongst the youth. Now, October is Mental Health Awareness Month, and Mental Health Day was celebrated on the 10th of October. And the theme for this year was the young people and mental health in a changing world. Now, the focus is on building mental resilience amongst young people to help them cope with the challenges of today's world. So today we discuss major depression, and our guests include a specialist psychiatrist and a clinical psychologist, and we also have two young men who share their stories with, how this depression has had, an impact on their lives. And you can be part of the show by asking the panel some questions or simply just sharing your views with us. The number to call is Johannesburg 714-6918 or 6919. You can also tweet us at SABC Health Talk or simply interact with us on our Facebook page, SABC Health Talk. So sit back, relax, and learn from this bumper show ahead. Coming to you just after a short break. I'm Dr. Silo Mutaung, and this is Health Talk.
They've wasted our time, they've made our members to go on strike, they've made the public to suffer for nothing.
Andikwazi ukutya i-treatment ngendlela ngenxa into yoba imali ayikho. Fumene i-600 xa ndiphinda futhi ndidrawa ayiphumi ayikho kwakwi-account.
What we are experiencing now is due to the number of people accessing the system at the same time. So if they can just be patient for 3 to 4 days.
All of us there in the NEC have our smallanyana skeletons, and we don't want to take out all skeletons out because they will be, or hell will break loose.
Buildings, submerged homes and devastated families.
Biggest earthquake in here.
Their homes and buildings moved like boats.
Big shake, and I ran as fast as I can.
These are the satellite images depicting the area before the disaster.
The ground is like a wave.
I've never seen anything like this in my life.
It is unbelievable. You can actually smell the stench of dead bodies around.
The National Hurricane Center said earlier on Tuesday that Michael was a Category 1 storm with sustained winds of up to 150 kilometers per hour. Residents were implored to get out of harm's way ahead of life-threatening waves, winds and rains. Flash flooding over the weekend caused 13 deaths in Central America after Michael formed off the coast of northern Honduras.
"23 years ago, Mam Zotwa gave birth to a beautiful baby girl, Kanyisile, also known as Tamia. After giving birth, she found out that her child had a serious health condition.
After ngiceda ukuthola ukhanyisile ne ngathola ukuthi ukhanyisile akekho right. And then ngamngela ukuthi akekho right. Nga-accept ukuthi akekho right ukhanyisile. Ngithe mangiceda kumthola ngamtholela eclinic, Emfulo clinic. And then ngithe mangiceda kumthola saye esibhedlela because icondition yakhe yayingekho right at all. Masifika esibhedlela mabam-assessa benza yonke into nama-test konke kwatholakala ukuthi ukhanyisile Edward syndrome.
Infants who survive this condition experience serious defects and commonly live for a short period of time. While Khanyisile was in and out of hospital, Mam Zodwa started to develop depression.
Kwaba umntwana oba in and out esibhedlela, most of the time in and out esibhedlela. Bengapheli 2 weeks angangenanga esibhedlela. 2 weeks ungena esibhedlela, 2 weeks ungena esibhedlela. Kube khona la makangena esibhedlela bangitshela ukuthi ena ngibuyele ekhaya. Akangenanga nasewodini. Basesebhizi ngaye. Bazongitshela ukuthi usaphila, usale waphila or undlulile emhlabeni.
Mam Zodwa felt that talking about her child's condition will not change her situation. Therefore, seeking help for her depression was short-lived.
Ngaseke ngiyamtshela lento doctor clinic ngoba yena bekafuna ukungirefer kuma psychologist. Ngaseke ngiyamtshela ukuthi hayi angazihluphi, yabo. Nami bengingazenzi mangisho kanjalo ngoba ngithe mangithi ngiyabheka. Okay, kuzonginceda ngani lokho? Kuzoshintsha yipi? Kuzoshintsha na icondition kaKhanyisile? Angeke kuzokushintsha icondition kaKhanyisile. Ngizolibela ngistress kube idepression yonke lento lena, yabo. Ngiyakuma psychologist still ngizobatshela ukuthi enenkinga yami yini. So akunamuntu ozosolve le nkinga le.
Parents of children with special needs tend to be faced with continuous barrage of challenges, like being isolated from society, financial strains, and difficulty finding resources to outright exhaustion or burnout. These are the things that caused Mam Zodwa to be depressed.
Kufika la uKhanyisile akhula khona. The more akhula uKhanyisile neyinkinga ziyakhula. Maka complicated ebusuku kumele ngifune transport, umuntu we-transport ufuna imali anginamali. Ziyangidepressa lezo zinto lezo kakhulu.
All right, so it's Mental Health Awareness Month, and we're focusing our discussion today on major depression. And to help us with this, two special guests. First up, Dr. Nkukuni Tima, who is a specialist psychiatrist based at Tara Hospital, and no stranger to the show. Welcome to Health Talk once again.
Thank you, Ndadimutana.
All right, and accompanying Dr. Tima is Cassandra Govender, who's a clinical psychologist and also works at The Couch.
Yes, thank you.
Welcome.
Thanks for having me.
All right, first let's start with you, Dr. Tima, with the basics. You know, we're talking major depression. Can we just define what it is exactly that we're talking about? You know, oftentimes people will have a feeling of depression, and you know, can we make a distinction there? What exactly are we talking about?
Yeah, I think I would also want to say thank you for giving mental health a spotlight again on your show. So depression essentially is a person has a sustained feeling of sadness, and this is also accompanied by a number of other difficulties in that the person loses interest in the activities that they used to enjoy, and you find their productivity, be it at work. I need to put in their school because I'm a child psychiatrist. You see a dramatic decline, and I think a big feature of this is that sometimes when it goes untreated, it's then followed by suicide attempt or completed in other cases.
Yeah. We're gonna come back and talk about impact, because I think you mentioned a very important aspect there, suicide. But let's just get a perspective from you, Cassandra. You deal quite a lot with, I would imagine, people with major depression or those on the brink, as it were.
Yes.
Just give us a sense of what is it that you meet out there.
Well, generally, I think, firstly, not a lot of people recognize that they're depressed. So they come in and I think they've been trying to cope for so long thinking that it's normal. But often what they come in with difficulty sleeping, struggling with appetite, and really they're only coming in because there's been, they're struggling to cope at work or at school with children. So they're actually coming when it's quite an extreme form, not when it's starting. But it's almost like a persistent sadness or sometimes aggression, so irritability that you see in people over, you know, a period of time in which their functioning just starts to decline a bit, or they're struggling to do what they would normally do a lot more.
One of the major issues, I guess, around mental health, not just, you know, about depression, is whether or not we have true statistics. Do we have a sense of the extent of this problem? All you know is that it's getting worse. Your view?
Yeah. I don't think we have true statistics, and especially in South Africa. I mean, you'd get studies done in other countries, Western countries, quoting anything between 10 to 20%, depending on the methods that have been used. And I'd imagine it will probably still be the same in South Africa as well. It's just we don't have proper studies that are done. But I know there's one study, big study that was done by senior colleagues called, I think, SESH study. It's quite available on the media, and it quotes around the same numbers as the international studies.
Right. Do we know who gets affected more? I know that the focus of our discussion is going to be on the youth, but who gets affected more? Age, gender? Do you have a sense?
Sure, I think that is actually a difficult one. I'm not sure, Dr. Tumi, you can help me with that.
So I think if you look at statistics, so the say pre-teen or pre-pubertal, the numbers are the same, be it boys and girls. And then come pubertal stages, you see the females then separating themselves in terms of numbers, even into adulthood. And then you see the difference also, males presenting, I mean, females being predominantly afflicted, but males don't come also quite close in terms of the numbers. But certainly peaks in adulthood, but the onset in many cases you'd find still in adolescence.
Okay, we covered the issue of symptoms, general symptoms. Perhaps you want to just, you know, go over those again, and even if we repeat them, it doesn't really matter, because I think it's important that, you know, people are aware of these symptoms, typical symptoms.
All right. Well, I think firstly a feeling, so just how your mood has been. Has it been changing? So has it been up and down? Has it been very low? Have you been a bit more irritable? Then there's changes in sleep, so sleeping all the time. I think that's typical for adolescents. They sleep a bit more, but more than normal. So teens normally sleep quite a bit, but they're sleeping all the time through their holidays. In adults, it could be that way, or really struggling to fall asleep, feeling very anxious at night, or lots going through your mind. So loss of interest, which is really important. So you know, activities you used to enjoy doing, you no longer find pleasurable. You've started to isolate yourself. You don't want to engage with people anymore. You don't want to do things. You're not feeling enjoyment. You know, struggling with energy, so feeling a bit of a low energy, a loss in concentration, so you're feeling your mind is very preoccupied. I mentioned the appetite as well, a loss in appetite or overeating, and then obviously suicidal thoughts. I think that's a big one. When you start to think in your mind, oh, maybe it would be better if I was dead, or I wish I could kill myself, or maybe I should think about killing myself, then you know that your mood is starting to take a really low dip, and it's a warning sign when you start to have those kinds of thoughts.
So we spoke about obviously major depression and so on. I mean, what's the normal clinical course for this condition? Do you ever get it associated with other conditions, perhaps, Dr. Tumi?
Yeah. So if I just wanted to add something on Cassandra, because there's also, you know, differences in presentation, sort of, I guess, cultural presentations, because, you know, in I guess sort of African cultures, we don't have the vocab to use in terms of expressing these symptoms, and some of the presentations might be like physical, like you know, generalized body pains, everyone like people complaining of tiredness, and that is what we tend to see as well in the context of Africans presenting. But according to, if I may, can you just ask your question again?
Yeah,
and
now, the clinical course and whether or not there's any other conditions associated with major depression.
Yeah.
We hear of bipolar disorder, for instance. Just clarify us on that.
So if you look at so children, it's probably even more complicated in that a lot of the time when they present, there's a lot. It might be more than just one condition presenting at the same time. So they might have ADHD, anxiety, and this will then be complicated by depression on its own. And adults, it might be probably a lot easier in that it might just be depression. But depending on the duration of the depression, adults might also have started engaging in self-medicating activities like taking alcohol or using substances, and that then complicates the presentation of depression. And so I guess depending on the age, but in terms of chronicity, so when people present for the first time, if you're seeing just depression, it might also be related to a bipolar, which is a manic and depressive presentation. But at the point of onset, it's not clear whether this presentation is going to be bipolar. Right. There are some telltale signs that people look at that might give an indication that this is bipolar. Like for example, if like what Cassandra was mentioning, like teenagers sleeping quite a lot. So if there's a lot of sleep, then that might indicate there is bipolarity. And also if they tend to eat a lot more, because inversely depression causes people to sleep less, or at least they would struggle to fall asleep or wake up very early. But when it's related to bipolar, they tend to sleep a lot more, and also their appetite tends to be raised. And so also in terms of symptoms, the sadness in depression is, it gets worse in a way as the day progresses.
I'll tell you what, let's take a quick break. When we come back, I'd like us to continue the story here and perhaps just touch a little bit on causes and risk factors, and of course then focus a lot more on the impact that this condition has on others. Please stay with us.
We pride ourselves on being impartial as well as independent. On the agenda, we basically break down the stories of the day.
Give the viewer the assurance that we will cover every side of the story.
Tear gas has now been also thrown at the protesters.
We are peacefully marching and the police is stopping the people. They're hitting the people. We are spraying the people with pepper spray. These people are supposed to protect us, but they are against us.
We are pushing them back by using the rubber bullets because we cannot allow them to block the roads and damage other people's property.
Quite important to bring on board all sides and hear what everybody has to say about the story, especially being the public broadcaster.
All in all, we basically take the news agenda of the day forward.
You would imagine if some of us joined the struggle and there were no people to look up to. There were no Mama Sisolos to look up to. I'm talking about her because I worked with her very closely in the UDF. She was at national level. Some of us were at what we called at the time regional level, PWV. So we worked very close because though she was a national leader, but she operated from Gauteng. All of us operated from here. So we learned a lot from her. But we also learned how to be resilient. We also learned how to smile in the face of adversity. Because if she had not had a husband for so many years, and we didn't even know what a wife means, we didn't even have wives, let alone girlfriends. So here is a person that you could look up to soften whatever blows that you got from the system, to soften whatever detention, to soften whatever torture that you got from the system, because she was there, literally there.
Mam Zodwa had to stop living for herself and shifted all her focus to provide for Khanyisile. This means all her hopes and dreams had to be put on hold for 23 years.
I-condition kaKhanyisile empilweni yami ingi-affectile kakhulu ngoba yonke into iyama. Azangikhona ukusebenza, azangikhona ukwenzani, ngaconcentrate kuye. Yazi khona kwesinye isikhathi mawumuntu ufuna uku-achieve ama-goals wakho, ne? Mina bengithanda i-fashion design. Umama bekathunga nami nginaleyo talent leyo kakhulu and ngiyakuthanda. Ngifuna ukwenza into ezinjengalezo, ngithunge, ngidesigne, ngenzeni. Mara due to i-condition kaKhanyisile azange ngize ngikhona ukukwenza konke lokho.
The thought of taking her own life came to her when she was feeling tired and extremely exhausted. All she ever wanted was to take a break from the 23 years of taking care of her child.
Ndezingidepressayo lezo kakhulu. Yazi makhathela umqondo, kukhathela umzimba, kukhathele yonke into ngathi ungathola i-break. I mean into nento uyayenza ufune i-break, yabo. So mangasathola i-break, ungasathola i-break, ugcina sowucabanga nezinto ezimbi. Bezingekho emqondweni wakho ziyifikele automatically. Mara kukho konke engidlula kukhona engingakusho ukuthi yazini yena ngiyamthanda umntanami ukuthi nje kukhathalekile yena ngiyamthanda shem.
Supporting a parent with a child that has special needs can help reduce the stress levels that the parents feel. Unfortunately for Mam Zodwa, she doesn't get much support.
Ukukwenza konke kuyashaya. Ukukwenza konke kuba sengathi somehow ungathola i-break, ungahamba uthola i-break because nomuntu osebenzayo omunye weekend akasebenzi, mhlawumbe ugcina emsebenzini Friday, Saturday, Sunday akasebenzi, and kwesinye isikhathi uyasebenza ne uvale December uthatha i-break. Mina ngikutholi konke lokho.
All right, so we continue our story on major depression. I'm still with my guest, Dr. Ngugune Dima, who's a child psychiatrist, Cassandra Govender, clinical psychologist, and we're now joined by two other special guests. First up is Sibusisiso Ngwenya, or Skinny Sbu, somebody that is founder and head designer of Skinny Sbu socks, and he's going to tell us about his story. Welcome to Health Talk, Sbu.
Thank you very much. Thank you to Health Talk for putting a spotlight on this taboo illness in our society.
Right.
Unfortunately, if we look at Historiska Mama Khanyisile, it's not a unique case.
Yeah.
I grew up in a 3-room shack in the east of Johannesburg.
I tell you what, let's just hold it there, because I just need to introduce our other guest who's based in our Devon studio, and this is Senzo Sbia, who's also going to share his story with us. Senzo, welcome to Health Talk.
Thank you, sir. Thank you, Dr. Utawung, for welcoming me on your show.
All right, I'm going to come back to you just now, Senzo. But first up, let's take Charmaine on the line. Charmaine, welcome to Health Talk.
Hi, good afternoon.
Hello, Charmaine.
Look, I just want to make a comment, and I think I just want to add, I've been down that road, and I really take my hat off to the mom that has a handicapped child.
Right.
But I think I'd like to say to the panel that we need to do more in identifying depression in younger children.
Right.
Because I think depression has no age. Right. And there are signs and symptoms, and the society we live in today, that younger and younger children are suffering with depression.
Right.
And it's just unnoticed, and parents see it as misbehavior, teachers see it as misbehavior. And so this child carries on, and eventually doesn't cope.
Yeah.
And either lands up suicidal, or these are drug addicts. So I think, and I really think that there's not much facilities that will help parents, because I've identified my grandchild's depression. She was only 6 years old when I detected certain behaviors of hers. And I took her for, to private psychiatrists, but it cost a fortune, which many parents can't afford. And there are only 2 facilities. There are Hima Musa, and I think Joburg General Hospital has TMO there.
Yeah.
But they have like a 2-year waiting list.
Yeah.
You know, so I really think that we should really use mental health week as a platform that we spread this out and get more help out.
Yeah.
But depression has no age.
Absolutely. Thank you so much for those lovely comments, Charmaine. Perhaps let's get a comment from Dr. Dima here. I mean, the issue around depression in children.
Yeah, I mean, she touches on quite a number of issues. Quite right. I mean, depression knows no age boundaries, and presentation differs at developmental stages. Earlier on, I mean, children are not able to express themselves in the vocab that adults would use, and what you tend to see there is like what Charmaine correctly points out: behavior. They're quite irritable. And obviously they would cause problems in class, and they'd get easily provoked and get into fights. And this is what we tend to see, and with obviously the academic decline. But then she touches on the costly private mental health services. And
we're gonna get to that when we talk treatment, because I think that's a very important point. But before we went on the break, we were saying that we will try and address the issue of possible causes and risk factors. That clip that we played obviously touches on typical, cause or risk factor, as it were, just apart from the impact. And I know that I need to come and speak to my 2 other guests, but let's quickly touch on the possible causes and risk factors for major depression. Any of you?
Okay. I'll start then. I think what you have to think about is it's kind of like a bit of a triangle. You've got something going on genetically, socially, and psychologically. So when you want to think about causes, you want to think about all 3 of those things. So there might be underlying genetics that pass through the family, and Dr. Tim will be able to talk to us about that a little bit more. But in terms of psychological, how your relationship with your parents, how you learn to deal and cope with your emotions, and social or societal pressures going on. What's happening in terms of the economy, socioeconomic status, how you grow up. And what can happen is, as you're going through life, a major event like a loss of a parent or difficulties at school, being bullied, it doesn't have to be something too major, can trigger the depression or the anxiety. And, how the types of relationships you have and support can then impact how that is then presented.
All right. Jonah, perhaps add one or two. She's covered it quite well.
She's covered it quite well, but I think I also just want to add, it's usually never just one thing. It might be, it's a lot of the time a combination of things, and in the social things a lot more, but usually a combination of factors.
Yeah. All right. Before I talk to my guests, there's 2 tweets that we once received from Sibusiso. If you could just get it up on the screen quickly, we'll just go over it before we talk to Sibusiso. And the people will have an opportunity to see the trendy socks that I am wearing, courtesy of Sibusiso Ngwenya. We'll try and get the tweets as quickly as we possibly can. Now this is from Sibusiso and sent it quite recently. He says that wanting a bigger and better life is taxing, running away from poverty is costly, stopping generational cashlessness is demanding and leaves you bone tired. I appreciate where I'm from, but I don't want to die the way I was born. And let's go over the second one. Honestly, I feel like giving up now. I've used all I have, sold my car to save the business, used my personal cash I make from speaking and endorsements to grow the sock business. Things are not as fancy. I am tired, I'm drained, I'm just here. Sibusiso, talk to us.
I think, what I was trying to highlight with my personal story of being raised by my grandmother and my mom is a very controversial issue that has not been brought to the table, Doctor, that most black people are suffering from depression and we are not aware of it.
Right.
It's the reason why sikhule sonke baskapa something ngephini with anything, because that is the only way how our single parents could really express themselves. We come from environments where it's a community. It's not created for men in particular, or for people in general who are seen to be strong or in the public eye like myself, to come out and say, I am suffering from, or my business going down, my lack of cash, my lack of this and that, and my past also is contributing to...
So were you diagnosed officially with depression, and were you in treatment?
Listen, I've had 2 sessions so when I sent out that tweet, Clinics Health Group came to my rescue and said, we think this has to do with a medical condition.
Right.
So I've sat down with a psychiatrist, and they said right now they do not want to give me any medicine or not. I should just attend a couple of sessions with them so that we can pinpoint what the matter is. But I can confirm that I am suffering a form of depression.
All right, let's just hold it there. We'll take Sinabu first before we cross over to Devon. Sinabu, welcome.
Hi, welcome. I'm in the morning.
Hello, Sinabu.
Yes, hi, how are you?
Good, how are you?
I'm all right, thank you. Taking it one day at a time. Thank you very much for hosting this very, very important issue that is forever negated in society, particularly about Department of Health, actually, come to think of it.
Yeah.
Moreover, within the black community, I think we ought to be addressing depression appropriately so, and I think the psychiatrist sitting right there next to you knows this all too well as well.
Yeah.
In that, more often than ever, patients, they will present when it's almost too late. I mean, the number of suicides or attempted suicides rather, that you see in emergency rooms are insurmountable. And I'll give you a definition of depression that I use. It is a perpetual state of paralysis where you find yourself in the darkest place, where you feel like no one can pull you out. And as a black person, particularly male, educated, there's this notion that you are seeking attention, so to speak. And actually, I want to commend the Skin for seeking help. Brother, you're not alone. Take it one day at a time.
Right.
And last but certainly not least, we ought to be looking at suicides within the medical society.
Absolutely. Couldn't agree with you more. Thank you so much, Sinabi, for those comments. And at this point, we're going to cross to Durban and speak to Senzo Sabia. Senzo, welcome once again.
Thank you, Dr. Mtawang.
All right.
Thank you.
If you could just, Senzo, just kind of take us through your story about depression. Have you been diagnosed with depression? Do you want to just perhaps share this with us?
Yes, sir. Yes, sir. I am diagnosed with depression. I got diagnosed 2 months back. I didn't know that I'm depressed. I was just living my life, and I thought that I've been through a lot when I was young, and then I didn't notice that I was depressed on that time. And also, in 2014, my mother got sick. She had disseminated TB, and then she passed away in 2015 on the 7th of October. And then we buried her on the 14th of October. I was taking care of her as sick as she was. I was changing her nappies. I have to take her to the clinic and stuff. So when she passed away, I didn't grieve, you know. I've been through a lot, and it has not been an easy journey for me to take care of her, you know. So I didn't notice that I'm depressed up until last month when I went to when I've SMS to SABC, the South African Depression and Anxiety Group, and then they diagnosed me with depression.
And how are you coping now?
I am coping because I'm attending a group at St. Joseph Life Hospital, with Dr. Lynn Norton of South African Depression and Anxiety Group.
Well, Senzo, first of all, thank you very much for being brave enough to share your story with us, because this doesn't happen often, that men especially, are willing to come out and share their story of how they are affected by depression. And I guess, this is one way that you're going to assist others that are watching this program to come out and talk and seek help. And the same goes to you, Sibusiso. Thank you so much for coming out and helping us spread the word and deal with the myths that are evident amongst our societies. All right, time for a quick break. When we come back, we'll continue our story with depression. Please stay with us.
Life can throw all sorts of surprises at you, often when you least expect it. Sorry, Mom. That's why it's important to have medical cover. Me? I didn't want just any medical scheme. I wanted a scheme that I could rely on, that I could talk to at any time, that I could afford. I didn't just get medical aid. I got medical paid.
She was really a great person, a humanitarian, and right up to the end, she didn't rest. She was with us to inspire everybody. There was not an occasion she'd miss if she could go. And much has to be written still more about her, but she'll go down in history as one of the mother of our country, of our nation.
Okay, welcome back and thank you so much for staying with us. We're talking major depression with our guest, Dr. Dimma from Tara Hospital, child psychiatrist, and Cassandra Govender, a clinical psychologist. And we now would like to talk about prevention. Perhaps that's the most important aspect. Before we do that, though, let's talk to Samke. Samke, welcome.
Hi, how are you?
We're good. How are you, Samke?
I'm good. How are you? Okay, I have a problem. I had a problem around 2010.
Right.
I just realized that I wasn't performing well at school, and then I saw that I wasn't like the normal kid as other kids, towards other kids. So I took myself to Baragwanath Hospital. And then I was told that I was referred to a psychologist. Then they told me that I'm suffering from depression.
Right.
Then they booked me to Tara Hospital, but I couldn't go there to Tara Hospital because I was still young at that age and I didn't know where Tara was. So I continued with the consultation in Baragwanath Hospital from 2010 to around 2013.
Yes.
And then in 2013 they told me that I have to now start with the medication. But the other psychologist told me, no, you can't start with the medication because I had like several cases of committing suicide. So they said it's not healthy for me for them to give me medication. Hence, I've been like, I've tried to kill myself several times. So they said, no, I would rather continue with the session.
Okay.
But that didn't help me because even today, I'm still suffering from depression. I've been through social workers. I've been talking to people, pastors, and it's something that's not going away because it's been with me, and it's really draining me at most of the time because I would like want to kill myself now and then. So I want help actually.
Okay. All right, Samke. Yeah. Thank you so much for deciding to call us. And I'd like you to just hang in there and continue watching because we're going to share very important information with you, especially around how you can get help. Let's perhaps get a comment from you, Dr. Tava. Yeah?
She describes a typical story in terms of the progression of the problems and presentation in terms of struggling at school, and it does seem like she's made attempts to get help. It's one thing for somebody to have suicide and have taken, I guess, overdoses, but then that does not necessarily preclude them from getting treatment, as in medication, because there are medications that are in a way designed to still be effective, but yet not fatal in overdoses. And I do think, if she can just go back and consult again and request to be referred to a psychiatrist who can discuss those things with her.
Yeah, okay, all right. Let's come back to the notion of depression, prevention.
Yes.
The suicide issue has come up, a few times. And of course, suicide is disaster, to say the least, How can societies, how can people watching this program know what to do, what to notice in people that would drive them to say, hey, go and seek help?
Sure. So, it's a good topic to talk about. I actually want to lead on a little bit on that, which is awareness and information. So I think our mental health care users aren't aware of the rights, not necessarily the rights they have, but the information. So they're not quite sure how it works in terms of medication. Sometimes a lot of our healthcare users don't even know what medication they're on, and they don't know what services to ask for. So I think it's really important what Dr. Tema said, because he said there are some antidepressants you can be on that won't kill you if you overdose on them, and it's important to keep that medication up. So when we're talking about treatment and prevention, it's psychoeducation. So having our mental health care users actually know there's different types of therapies. Therapy will help. We had our mum in the video saying that I don't want to see a psychologist, my circumstances aren't going to change, so what would that help? So I know that digressed a little bit from what you asked me, and I'll get back to that, but I think
it's important.
It's really, really important to note that we do need to talk about these things and understand that they can be help. Just because I'm unable to take the situation away doesn't mean we can't sit together and really talk about it and help you feel some relief, even if temporarily.
Okay.
So in terms of signs that you can note in people, again, I think it's looking at isolation, looking at changes in behavior. So this person is now becoming more irritable. There's a decline at work or school. They're fighting with you a lot. They're sleeping more or less. Their appetites have changed. They've expressed to you they're not feeling okay, they're not coping okay. Take it seriously. Rather get them help and get them checked and encourage them to see someone.
Right, all right. Perhaps you want to just come in here, especially around, children, and the several risk factors that we touched on a little earlier. What is it that parents can do to try and avoid kids tipping over into depression?
Yeah. Well, I guess you're talking about parents. I think sometimes it's the environment, which is home, which would typically make children feel depressed, or at least get depressed. And we're talking about kids that are exposed to domestic violence in their household, alcoholic parents that are actually not necessarily paying attention to the children who a lot of the time would be left unsupervised, and then kids will then go into mischievous activities because they are not supervised, and sometimes school can also play an important role in picking up these difficulties, and I think all it takes is just an attentive adult at school to just ask a child who's disruptive in school and just ask them why would they be doing that, because a lot of them might essentially be reacting to the stressors they face when they get home and they display this behavior at school. So I think schools can play quite an important role in identifying that.
All right. I believe we have a few more tweets that we would like to go through. We'll just need to get those up. Shane says, speaking up is so much easier said than done. Mental health issues are no joke. Battling with depression has been one of the toughest battles of my life. But I'm still here. I have trouble speaking about it, but I know I can if I need to. And then Dawn Scott says, it is heartbreaking to hear my 11-year-old son say, what's the point in life? The world is already ruined. A growing link between children's mental health and the state of the planet. They need to know there's a positive future for them and the planet. And The next one is from SAD disorder. Both men and women can have mental health issues, and neither should be ashamed of that. We shouldn't have to act like everything is okay and try to fit in with society's expectations, because most of the times that is just an act. So true. Colin says, there's a lot of heartache in life, a lot of darkness and lonely times. We all have the power to reach out and be someone's shining light in their moment of darkness. Please make someone's heart smile. It's free to do, but the rewards are priceless. Shavindri says, had a patient today with depression and she thought that meant she was mentally ill and treated herself with shame. Don't ever think that you are worthless because you're suffering mentally. Everyone mentally suffers, but only a few want to get the aid they need. All right, we're going to go for a short break. When we come back, we continue our story on major depression and this time focus on treatment. Please stay with us.
The great bank heist. Well, it was brazen. It was quick.
One thought we're perhaps looking at figures much, much lower. Right. It's almost 2 billion.
It was shared amongst very greedy VBS executives and politically connected individuals. You are listed in that report. Did you steal money?
The narrative that they're trying to create is proven wrong by Advocate Mtao's report himself. He said in point 59 that he could not find a definitive wrongdoing, anything factually.
The misleading information which Daily Maverick has is deliberate. It's part of the whole propaganda machinery. You can challenge this Polly Fanville to bring us the so-called evidence that I received 10 million. It's pure insanity.
Is there any prospect whatsoever of saving VBS?
We are not as confident as we were when we started the curatorship as to restoring the bank.
The bank is in a hopeless situation and it cannot be saved.
We are losing the best of kids. People that are fathers or pastors that comes from a church.
No taxi, nothing. We were not notified. I get to town, there's nothing.
We are in the fourth industrial revolution.
Things aren't the same anymore.
Technology is taking over much of what we do. That includes how we make payments.
Blockchain is the future.
On Network, we have robots, hackathons, and tech entrepreneurs.
Making sure that your business is well known across all borders. We use social media.
That's Network with me, Pumela Zondi, on Saturdays at 20:30 and Sundays at 17:30.
To be a part of something like this makes me proud. And I think that to be able to report the news in a fair, just, independent and impartial way is what the public broadcaster stands for.
Right, welcome back. We'll continue our story with Dr. Nkukune Dema and Cassandra Govender, and we're obviously talking major depression, and now we're going to focus on treatment. But before we start our discussion on treatment, let's speak to Musiwa on the line. Musiwa, welcome.
Hi, how are you?
We're good. How are you, Musiwa?
Hello? Okay. I'm actually shaking right now.
Yes.
I think I do have depression because I have a few things that I think of. I think of killing myself sometimes. I've tried to kill myself twice, and I have.
Yes, Musiwa, carry on.
I have a lot of things that I think of. But when I think of my kids, I just have to push on, have to live on. But sometimes I feel like it's too much.
Have you tried to seek help, Musiwa?
Yes, I have. But all the times when I do that, something comes up and I have to leave it and have to do something else. Yeah.
Okay. Well, Musiwe, just hang in there. We're gonna, share some important information with you as we go along. Perhaps let's try and ask Cassandra to comment on that. I mean, she seems to be going through quite a lot.
Yeah,
what can she do?
She does sound really distressed, but I think Musiwe and the previous caller, they highlighted something very important for me, which is that idea that they're really struggling with how they're feelings and to cope with their emotions and their experiences. And often then I want to suggest to those kind of clients that they should seek a particular kind of therapy. So not, sometimes, as she was saying, that sometimes stuff gets in the way of her treatment and she can't always make the talk therapy, and that's what previous people have been to. But dialectical behavior therapy is a specific kind of therapy that's aimed to help you cope with that. So,
but how do people access that?
Well, that's
and how will they even know about it?
Well, that's why I'm mentioning it now. So this is what it links to my point earlier around psychoeducation being so important and valuable, because I want people out there to know and understand that when they are going through this, that there is a way that we can try and help them. And there's a specific kind of therapy that we want to try first when talk therapy isn't so helpful. Generally, there should be a lot of your hospitals, your Tara, your Helen Joseph, your Barra, a lot of them have dialectical behavior therapists. The therapists there are able to do that. It's just about asking for those kinds of things.
Yeah. Dr. Tema, treatment of any mental health illness is a multidisciplinary type of approach, isn't it so?
Yeah.
Who are the people involved? I mean, certainly it's not only doctors.
No, and certainly not. And I think maybe we also need to start from the community in that at a clinic, any trained professional nurse would be able to spot a person that has got depression. General practitioners that are quite, and I've got a number of them in the communities, be in townships or even in urban settings, they would be able to diagnose and initiate medication and proper referral if need be. But certainly there's a number of people that are involved. So you'd have the medical team in terms of assessing and escalating and reviewing medication as if necessary. And then you also have people that would do counseling or therapy, psychologists, and you have people that assist with practical things, assessing functional capacity, like your occupational therapists, and also social workers who I think are quite a resource in terms of assisting with practical help.
Right. So in terms of the actual treatment, then oftentimes you hear that treatment is usually for a long time, and people need to stick on treatment for a very long time. How can they be assisted, to stick to the treatment?
So it's a bit of a difficult question to respond to, because if you're going to start treatment, it helps if you stay on it for a long time. But obviously there's other problems that come into it. People forget or people can't afford. But also even people that are on treatment, sometimes they don't get better. And I think I just want to quote the case that you were showing in the background. If you have a persisting stress in the background, regardless of how much bags and bags of medication you are taking or how much talk therapy you're doing, if you don't have any practical assistance with what you are struggling with, that will not go. The depression will not go. So, but it does help to stick to treatment. And I think what we say is, if you've just had one episode, it helps to stick to treatment for about 6 months, because that's how long it takes to get better. And if there's repeated episode, it helps to stay even longer on the medication.
So the issue of support then obviously is important. Support from the immediate family. Can you expand a bit on that?
So I think support in two kinds of ways. Support from the immediate family, but also using your therapy space in a supportive kind of way. So as Dr. Tema mentioned, there's practical issues that sometimes need assistance in the environment, and that's being able to reach out to people who can help you with that. So realizing that even though we come and we talk about the things you're struggling with, it will take you so far. And, being able to reach out to a family member that you can trust or a friend you can trust to sometimes help you with that.
And of course, there's support groups elsewhere. There's the SADC. We're going to give out, contact details later on. I'm afraid that's where we're going to have to leave it. There is just so much to talk about, but so very little time. Thank you so much for your contribution. Well, that was Dr. Nkukuni, child psychiatrist based at Tara Hospital, and Cassandra Govender, clinical psychologist based out in Johannesburg. And of course, we had two previous guests, Busi Songwenya and Senzo Sibia, who shared their stories with us. Well, thank you so much for staying with us. We're back on your screens again in a week's time. And yes, thank you to every single one of you that took the time to call us and send us tweets. And we back next week. And until then, please do take care.